You see, this video is an advice and my own opinion for every woman who want to do IVF or want to repeat a failed cycle IVF. One of the process of IVF is sonoesterogram. This is a test they will do to check the mouth of your womb and inside your womb, because the mouth of the womb must be free so that when they are transferring embryo to your body, it must enter free, because if there is any obstruction and the blood touches the catheter, then the embryo in front will die immediately. So the mouth of the womb must be free. If the mouth of the womb is not free, we will recommend a cervical dilatation. One of those things is there's something that could warrant mouth of the womb not free. One, there's something we call cervical stenosis. Cyst could be at the mouth of the cervix, gonapotic cyst, and all the rest. If they check inside the womb, and inside the womb is not free, like the inside the womb, we call it endometrial cavity, is not free enough. Or whether there's a endometrial cyst, there's scar tissue, there's adhesion, there's a polyps, small fibroid, these must be removed before IVF procedure will be taken as a possibility. That is not where I'm going to. If you have ever done IVF procedure and sono is not part of what they have done for you, then we need to ask, how do they know that your womb is ready for this procedure? So this is where I'm going to. It is my own opinion. So that somebody will not come online and say, and what you are saying is not true. And I carry my baby. No problem. How many number of people in 1,500 that can say what you are saying now, that will be acceptable, that it is normal? What you need, if you do sonoesterogram, even if they tell you you have fibroid and it is not displacing endometrium, that means it is not in a position that will not allow you to test positive. Small fibroid, 1 centimeter, 2 centimeter. I want to advise, that is an advice, is my own opinion. Remove it. Let your womb be clear. Let your womb be free of anything. It is not easy to gather money. Apart from gather money for IVF, the emotional traumas that follows when the procedure fails. It is my own opinion and my advice. And if they ever find anything in your womb, and you are being told that it may not disturb the success of the procedure, I'm begging you in the name of God, clear it. If it is a small fibroid, you can use hysteroscopy to clear it if it's not too big. Because see my own thought about this, because I've seen many people, they have a failed cycle, but when you see their scan result, you see fibroid that is there, because the fibroid is not inside the endometrium. But that is why they claim it can't disturb the process. But now the process is not successful. We don't know where the problem is coming from. IVF fails like water. Let us discuss the little things that we neglect that can make the procedure fail. Nobody knows anything. But the one I'm talking about, let us look at whether people can benefit from this talk. Small fibroids, 1 centimeter. Look, what I understood very well about implantation is when the embryo is coming and they drop embryo inside your womb, if that embryo fall on top of anything that is not directly on top of the endometrium, there's no way that embryo will attach to the body of the endometrium and start germinating. So if they say you have small fibroid, but the fibroid that is there cannot disturb, okay, when they transfer the embryo to your womb, who dictates where the embryo will attach in your womb? What dictates where the embryo will stay in your womb? And when they drop this embryo, and let's say it is being guided on sono, what happens? If you stand up, the embryo move and go and stay on top of small fibroids. It is my own opinion. Let the womb be cleared completely before you do IVF procedure. Fibroid can disturb, remove it. So that maybe if we start looking to all these small things that we overlook, maybe the success rate of IVF will increase. If you want to do IVF procedure, you can take supplements to improve your endometrium receptivity. You can take fertility supplement to prepare your body. Because some of you will come and say, they don't tell us. That's a certain thing that is common. It's a common sense thing. Did anybody tell you that when your bladder is full, you must go to restroom to go and urinate? You know that is the next thing now. You want to do procedure. You are not on any medication. In my own opinion, buy fertility supplement, prepare your womb. If you are not using your egg, if you are using your egg, take supplement and improve the quality of your egg. There's nothing like, they don't tell me. No, you can hack things. It's a common sense things. God will help us. Please, Let your womb be cleared before you access IVF procedure. Maybe it will improve and increase the success rate. My name is Wojo Adekende Samuel. I'm a practicing fertility scientist, a brand ambassador of Fertility. If I come your way next time, God is good. Bye.